So I often get asked about regenerative therapies, and there's a discussion about which different regenerative therapies. So when we're talking about joint disease, we're talking about three main therapies for joint management using under the regenerative therapy title. So the three are PRP, platelet-rich plasma, ProStride, and IRAP. So let's delve into each of them and when we would use them and why we would use them. Fundamentally, we use regenerative therapies in two situations. One, we've got a horse that's insulin resistant, so we don't want to use corticosteroids for joint management. So we want to use something alternative that's safe, that doesn't have a risk of laminitis. So cortisone has a very small risk of laminitis, and especially in horses that are insulin resistant, high insulin levels. So that's why sometimes when we see you and we're talking about joint management, we're going to go direct into the joint. We might consider running an insulin test to check what the basal resting level of insulin is. If it's elevated, then that takes cortisone off the table and we can't use that. So the next step, we then consider the regenerative therapies. So PRP, platelet-rich plasma, is a regenerative therapy. We would use these also when we've got a young horse with showing some joint disease and we want to try a healing response. We're not just dampening the inflammation, we're using it as a healing response. So PRP, platelet-rich plasma, is a really simple, effective. We can spin it. I designed my car around the centrifuge for PRP in the field. So we use that there. It's quite a cost-effective treatment. We might use it for some mild joint inflammation or for something like a stifle where we're querying we might have a meniscal lesion. So we want a regenerative response. The next treatment we'll talk about is IRAP, interleukin receptor antagonist protein. Now that protein is very influential in joint repair. So with IRAP, we take 60 ml of blood, we incubate it for 24 hours, then we spin it down and we separate it out we get rid of the red blood cells and we're left with a serum. With that serum, we usually harvest somewhere between 18 and 28 mils on average per horse. Now with that there, we then separate that down into individual samples that we inject back into the joint. The advantage of IRAP is we get more than one-off treatment. We get multiple treatments out of it. Now, depending on the joint size, so something like a hock joint, tarsometatarsal joint, we only need 1 to 1.5 mils. So you can imagine out of a 21 mils collection, we're getting in the region of 14 treatments out of it. So it's very cost effective actually when you add that up over the time of the horse. If you're using, say we're doing a coffin joint or a fetlock joint, we might use 4 mils. So we don't get as many treatments out of that. But the treatment can be stored and frozen, and then all we have to do is thaw it and use it. We can store it for 12 to 24 months, and it's a really good treatment. I've been using it for a long time now. Where it's really useful is post-arthroscopy, post-surgery, when we've removed an OCD fragment and we've identified some damaged cartilage. Really useful for those type of lesions. Also really useful for young horse with fetlock joint problems or some early hock problems. We also really like using it. I find it very useful when we've got some lower hock joint pain and proximal suspensory pain. Very beneficial there and really useful to use. So we've used the IRAP. PRP is an option, and then we talk about ProStride. Now ProStride is a combination of PRP and IRAP. The advantage of ProStride, and the reason we added it, it's a single treatment. Usually lasts somewhere between 6 and 12 months. The benefit of ProStride is you get the combination of IRAP and PRP. The other advantage is we don't have to incubate it, so it takes about 30 minutes to process a sample, and then we can inject it back in. We'll usually get enough to treat between 3 and 4 joints. Very useful treatment. We've only recently added it in the last 6 to 8 months to our therapy list, but it's a really beneficial treatment and we find it, really useful. Really like to actually use it in older horses that may be a little bit insulin resistant. I don't want to use too much cortisone, or horses that we've seen and they've come from a distance away, and we're using it from a practical point of view. You don't want to be coming back and being treated multiple times, and that's something I forgot to mention about IRAP. IRAP we usually do 2 to 3 treatments about 10 days apart, 7 to 10 days apart. And the reason we do that there is we need to build up the levels. You then can top that horse up again, so you only need to do one treatment to top it up down the track. So each therapy has a benefit, each therapy has its weaknesses, and between the three of them we can cover a wide range of things. Now, PRP is also used in tendon and ligament injuries, and we inject it direct into the tendon and ligaments. So each has their advantage, but really beneficial used in the right instance. So hope this helps explain some of the differences we see between the different therapies around. Please do ask questions, and I will catch up with you guys soon. Thanks very much. Bye.